Good morning, USRN. Welcome to our OB nursing discussion. Kasama po dyan si delivery, labor, problems in labor, 3 P's of labor, stages of labor, phases of labor, station of labor, and fetal heart monitoring. Alright, the first topic would be OBGYN nursing. Talks about delivery. Ovaries, nandyan po yung hormone natin. Hormone production po and regulation. Hormone production ng ovaries, nandyan po si estrogen and progesterone. Kay estrogen, nandyan po si Spinbar K. Si Spinbar K is responsible for cervical mucus, mood swings, osteoblast, and osteoclast. Again, si estrogen, always remember Spinbar K, which is the cervical mucus, mood swings, osteoblast, and osteoclast. Patient is at risk for osteoporosis on menopausal kasi there will be decrease in estrogen level. On the other hand, the progesterone, nandyan po si sodium and water production, fat metabolism, and retention. There should be a balance in uterine lining. So kapag merong decrease of GI function, that will be due to constipation. So kapag constipated si patient, there will be decrease in GI function. Smooth muscle relaxation, we have heartburn and lordosis kapag may problem. So we've talked about ovaries, now we will talk about uterus. Uterus naman, nandyan po nag-i-implant si baby. For implantation, watch out for foul-smelling odor and leukemia. The blood signifies endometriosis. So we have ovaries, uterus, and the third one we have cervix. Si cervix, dyan po yung engagement of fetal head. So, seen problem on mother kapag merong problema sa cervix, we have 2. Incompetent cervix and cerebral palsy. Pagdating sa baby, kapag may problema tayo sa cervix, kay mother, incompetent cervix, kay baby, cerebral palsy. Fertilization site is in fallopian tube. Kapag merong problem sa fallopian tube, on the ectopic pregnancy side, tawag po dyan is ampulla. Kapag sa tubal site naman, is sa isthmus. Si ampulla and isthmus, those are parts of interstitium. Number 5 is vagina. So we talk about ovaries, uterus, cervix, and next one is vagina. Diyan po yung passageway. Diseases in the vagina, we have gonorrhea and or chlamydia. Gonorrhea and or chlamydia will result to ectopic pregnancy. Side notes tayo. Baggy uterus, signs and symptoms would be rigid or rigid abdomen in the test. Testosterone is the male secondary sex hormone. Okay, recap tayo. Meron tayong 5 importanteng parts sa OB. We have ovaries, uterus, cervix, fallopian tube, vagina. Si ovaries, nandyan po yung hormone production natin or hormone regulation. Be mindful of estrogen and progesterone. Kay estrogen, nandyan po si Spinbar K, cervical mucus production. Dyan po din nakukuha yung mood swings ng ating mga mommies. Osteoblast and osteoclast. Risk for osteoporosis on menopausal. On progesterone naman, on the other hand, nandyan po yung balance and increase in uterine lining. Kapag merong decrease of GI function, that is due to constipation. Smooth muscle relaxation. Patient will experience heartburn or lordosis. Sa uterus naman is where the implantation takes place. Watch out for foul smelling and leukemia. Sa cervix naman, this is where the engagement of fetal head is. Ang problema sa mother side is incompetent cervix. Kapag yung problem naman sa baby is called cerebral palsy. During fertilization, the site is in the fallopian tube. Kapag merong ectopic pregnancy, ang sign po dyan sa fallopian tube ay si ampulla. Kapag meron namang tubal site ligation, ang site po dyan sa fallopian tube ay si isthmus. Parts po siya ng interstitium, si ampulla and si isthmus. Number 5, vagina, passageway. Evaluate for diseases like gonorrhea and chlamydia that could cause ectopic pregnancy. Side notes, baggy uterus could be leading to sign of rigid abdomen during the test. Testosterone naman is male secondary sex hormone. Alright, now we will talk about labor and delivery. Ano ba yung mga question na pwede nating i-question kay mother during pre-op? So when is the expected date of delivery? How was the uterine contraction pattern? Also, we need to check, ano po ba yung kulay ng amniotic fluid? Greenish ba siya? Because if it's greenish colored amniotic fluid, that pertains or denotes infection. Complication of amniotic fluid, we have meconium aspiration. It will lead to respiratory distress and shock. Ask if it's a multiple gestation. Ask for past medicine intake and also check for the latest ultrasound. Oxytocin is responsible for uterine contraction. Oxytocin overdose will lead to increased uterine contraction that will lead to fetal death. Management for oxytocin overdose, we have the mnemonic strand. We have to stop the infusion, time the incident, reposition the mom on her left side, assess for fetal heart rate, notify doctor, document. In order po yan. So sa preparation naman, for oxytocin, we need to measure the uterine contraction of the fetus or the baby, assess for fetal heart tone, and placed infusion pump. Ang antidote naman ni oxytocin is isotonic solution. Kapag hindi available si isotonic solution or si first tonic, use hypotonic solution. Okay? Alright, we will go now to problems in labor. Nandyan po si PROM or premature rupture of membrane. This is an emergency. Risk dito are those patients or moms who are primigravida, first time palang manganganak. Causes nito includes infection and trauma. Complication nito to the mother is infection, to the baby is shoulder dystocia. Tandaan, ang complication ng PROM sa nanay is infection, kay baby is shoulder dystocia. Signs and symptoms to the mom is severe abdominal pain. Next one is oligohydramnios. Oligohydramnios, from the word oligo, kulang. Hydramnios is fluid, amniotic fluid. Ibig sabihin ng oligohydramnios is less amniotic fluid. Ang complication naman nito is towards the baby. Kapag kulang si amniotic fluid, magkakaroon ng umbilical cord compression. Umbilical cord compression will lead to decrease in oxygenation that will lead to pulmonary hypoplasia and respiratory distress syndrome, cause of death in respiratory cases. Management nito is hydration. Manage at least 2 to 3 healthcare providers or nurses pagdating sa case ng oligohydramnios. Next problem in labor, we have inability of the membrane to pop out. Management nito is amniotomy and artificial rupture of membrane. Nursing consideration, check for fetal heart tone or check for the mother's temperature. Also assess the uterine pattern and note the color of the amniotic fluid. Next would be labor tips. There are 3 P's of labor. Ito yung passage, presentation, and position. For passage, we have gynecoid. Ito yung ideal, high percentage of normal, spontaneous vaginal delivery. Android, high percentage of cesarean delivery. For presentation, we have cephalic, breech, and shoulder. Cephalic, head, brow, or mentum. Si breech naman, footling or frank. Footling or frank. Mom, scoliosis. Baby, shoulder dystocia kapag merong problem. Positioning naman, right occiput anterior or ROA, most painful fetal position, induces back pain. Management, apply counter pressure or massage the flank area. Apply counter pressure or massage flank area. Now we come to stages of labor. Meron tayong 4 na stages. Stage 1 is from uterine contraction to full cervical dilation. Uterine contraction to full cervical dilatation. Stage 2, from full cervical dilatation to baby delivery. From full cervical dilatation to baby delivery. Stage 3, from the delivery of the baby to the delivery of the placenta. Stage 3, from the delivery of the baby to the delivery of the placenta. Stage 4, from placental expulsion to 1 to 4 hours postpartum. Stage 4, from placental expulsion to 1 to 4 hours postpartum. Next is the phases of labor. We have 3: latent phase, active phase, transitional phase. Again, latent phase, active phase, transitional phase, phases of labor, lat, bilat. Phases of labor, bilat. Latent phase, active phase, transitional phase. This is the end stage of labor. Sa latent phase, cervical dilatation of 0 to 3. Sa active phase, cervical dilatation of 4 to 7. Transitional phase, cervical dilatation of 8 to 10 centimeter. So para hindi makalimutan ang cervical dilatation, I have 3 numbers there, 3, 7, and 10. Cervical dilatation, 0 to 3 centimeter for latent. Active phase naman, 4 to 7. So after 0 to 3 is 4, 4 to 7. Pag inad mo yung dalawa, 7 plus 3 equals transitional phase, which is 10. So si transitional phase naman is 8 to 10. So magkakasunod-sunod lang po yan. Si active phase, nandyan po yung time, or that's the best time to give Demerol. Si transitional phase naman, that's the crowning or the bulging. Sa uterine contraction naman, there is a decrease in frequency and increase in duration or intensity. Frequency of labor for latent phase is 5 to 10 minutes. Active phase is 3 to 5 minutes. And transitional phase is 2 to 3 minutes. So yung frequency, pag nakita nyo, pababa siya, going down. 5 to 10 for latent, 3 to 5 for active, and 2 to 3 minutes. Again, in order, latent, active, and transition. 5 to 10, 3 to 5, 2 to 3. So kay latent phase, mag-start siya from 5 to 10. Kay active naman, mag-start siya from 3 to 5. So yung 5, latent na yon. Sa transitional naman is 2 to 3. So si 3, that's already active. 5 to 10, 3 to 5, 2 to 3. For the duration, pataas naman. Latent, 20 to 30 seconds. Active, 30 to 45 seconds. And si transitional is 60 to 95. So yung counting naman ito is seconds. 20 to 30, 30 to 45, 60 to 95. 20 to 30, 30 to 45, 60 to 95. Si intensity naman, pataas. Mild, moderate, strong. Mild, moderate, strong for latent, active, and transitional in order. Signs of true labor, we have regular uterine contraction. Pain cannot be relieved by walking. Pink show progressive to bloody. Progressive ang cervical dilation. Next topic would be station of labor. Station of labor. Parang Boracay lang, no? Laborakay. Meron din siyang station. First part of the station is -4 down to -1. So -4, -3, -2, -1. Sa gitna po si station 0, which is floating stage or station. Meron din po tayong 1, 2, 3, and 4. Si 1 and 2, that's cervical, baby is engaged. 3 and 4, vaginal. 5 is crowning. So station -4 up until 5. -4 to -1 is symphysis pubis. Sa 0 po, naka-float na si baby. 1 and 2, cervical or cervix, baby is engaged. 3 and 4, vaginal. 5 is crowning. Cervical dilatation. Cervical dilatation from -4 to -3 is 1 to 3 centimeter. 1 to 3 centimeter. So tandaan lang si number 1, 2, 3. Si -2 to -1 naman is 3, 4, 5, 6. Kasi 3 to 6 centimeter siya. So para ka lang nagbibilang 1, 2, 3, 3, 4, 5, 6. Effacement niya or cervical thinning is 10%. Kaya cervical dilatation. 10 Sean. T-I-O-N or T10N. Cervical dilatation. Sa floating naman, wala siyang effacement. Yung floating naman from 0 to 4, yung effacement niya is 50 to 60%. Yung counting niya sa cervical dilatation, si 1 and 2 station is 6 to 7. Si 3 and 4 station naman is 8 to 9. And si crowning is 10 cm. So yung counting sa cervical dilatation, kapag station 1 and 2 is 6 to 7, para ka na rin magbibilang 6, 7, 8, 9, kay station 3 and 4, and 10. So pag napansin nyo sa cervical dilatation from -4 down to 5, para ka na nagbibilang 1 to 3, 3 to 6, and then 6 to 7, and then 8 to 9, and then 10. Si crowning naman yung effacement niya kapag umabot na sa 10 cm is going to be 80 to 100%. Kailan natin pwedeng i-transfer si mother from the labor room to the delivery room? Kapag priming gravid na patient, kapag mag 10 cm na or 10 cm cervical dilatation, pwede na siyang i-transfer. Kapag multi naman, 7 to 8 pa lang centimeter cervical dilatation, i-transfer mo na siya sa DR. Kasunod naman po dyan si fetal heart monitoring. Meron tayong 4. Acceleration, early deceleration, late deceleration, variable. So, AELV. AELV. Acceleration, early deceleration, late deceleration, variable. So, una mag-accelerate muna, tapos mapapa-early siya, kaso lang na-late siya, kaya nagkaka-variable siya. Management for acceleration, that's normal, so monitoring lang. Early deceleration, management niya is IV and oxygenation. Si late deceleration naman, yung management niya is LION. Left side, IV, O2, notify. Left side, IV, O2, notify. Same thing with variable, LION. Left side, IV, O2, notify. So, ang variable, we have the mnemonics VIL, CHOP. Kapag si variable, the main reason for that is cord compression. For early deceleration, it's going to be head compression. Acceleration, that's okay or normal. And for late deceleration, that's placental. So again, variable, cord, VC, variable cord compression, E, head compression, E, head, AO, okay, AO, okay. LP, placental, placental insufficiency. Side notes tayo. General answer, kapag management, especially sa late deceleration and variable, meron tayong mnemonics na LION. LION, left side, IV, O2, and then notify. Testosterone is the male secondary sex hormone. Amniotic fluid is for lubricant. So kapag hindi dumudulas, lagyan mo ng amniotic fluid, lubricant, para dumulas. It also regulates temperature. Nakakainit. Protect the baby. Protect the head, the ulo. Protects the baby cushion. Thanks for listening.